My name is Lyle Murphy, the founder of the Alternative to Med Center, and today we are going to be answering questions on what are the long-term effects of Lexapro. The first question is, what are the side effects, the more serious side effects of Lexapro? Well, the more common side effects are headache, nausea, diarrhea, dry mouth, increased sweating, feeling nervous, restless, fatigue, or having sleep problems. These are the symptoms that show up more commonly. However, the more serious side effects are going to be ones that look like an allergic reaction to the medication. And those could include trouble breathing, being locked up in the diaphragm, having muscle stiffness, swelling of the face, tongue, ears, or mouth, and rashes, hives, blisters, and possibly joint pain. Those are going to be more serious, and those certainly are ones that you need to get urgent medical attention for. Next question. Will I gain weight on Lexapro? Well, Lexapro is one of the type of antidepressants that you can gain weight on. Basically, a medication that's going to boost as a standalone serotonin. Serotonin is an inhibitory neurochemical. When you're getting more of an inhibitory neurochemical, you're going more into that relaxation, more into that parasympathetic mode of your nervous system, and that could increase your appetite. And typically, that may not be the worst thing for most people. Next question, will I gain weight on Lexapro? Well, Lexapro as an SSRI is limiting itself primarily to serotonin. Anytime you're increasing an inhibitory neurochemical like serotonin, there is a possibility that you will gain weight. Because what's happening is you are now putting more emphasis on the parasympathetic part of your nervous system, which is associated with feeding and breathing. And about 25% of the people taking Lexapro have reported at least a 10-pound weight gain. Next question, what are the mental side effects of Lexapro? Well, they can be different for different situations. The more common and more intended effects would be that you don't ruminate as much, that you have a little bit of just kind of feeling. But paradoxical effects or serious mental side effects could be an increase in your agitation, hallucinations, coma, and there's this phenomenon called disinhibition. It's sort of similar to when somebody drinks alcohol and suddenly the normal social anxieties and things that they have may be lifted, or it may be even more severe than that, where like the intended effect is to keep you from acting out certain impulsive behaviors. But in certain people, there can be a paradoxical effect to this medication where you actually do go and act those things out, and that would be termed disinhibition. What should I avoid while taking Lexapro? Grapefruit inhibits a certain enzyme that breaks down a lot of these medications. It'll actually make the medication more potent, and it's not like you can't eat grapefruit now and again, but if you're subsisting off of it, or you just got a gallon jug of grapefruit juice or something and you're like drinking, a quart of it a day, that might be a problem in conjunction with this medication. Alcohol, of course, is not a great idea. I mean, most people that drink alcohol and ask that question, can I mix this alcohol with my antidepressant? They're going to do it anyway, regardless of what you tell them. But when you're combining two different sedatives together, that's not a great idea. And I think more importantly is a lot of the reasons why we end up serotonin deficient is when we're over-consuming sugar or alcohol, because there's a physiological mechanism there that when you're dumping insulin, it causes all the tryptophan, which is the precursor to serotonin, to be, all the other amino acids get chased up into your tissues, but tryptophan doesn't. So tryptophan gets spent in the first 2 hours of consuming a large amount of sugar or alcohol, and then there's a depletion that happens, a rebound effect that happens after that. So if you're depressed to the point where you feel like you need a medication and you're also drinking, maybe consider that the alcohol might be something that needs to go before you start adding other medications that are just going to make the situation possibly compoundedly worse. And a few other things to avoid when taking Lexapro. Tryptophan and St. John's wort are kind of the more natural ways to go about raising serotonin. And by doing both of them at the same time, you could get too much serotonin, which could result in a rare but definitely serious scenario called serotonin syndrome. And another thing for those who are considering doing an ayahuasca ceremony, being on a medication like this does not go well with ayahuasca. Many people had incidences that may have been fine without combining it with the medications, and they were pretty serious, so definitely be aware of that. Next question, can you take Lexapro for years? Well, I guess that depends on who you ask. NAMI, who is not always the most, that it many times disregards patients' real stories and the problems that people having starting these meds, stopping these meds, or being on them long term. They even said that antidepressants are meant more for the short term, and that prolonged use can cause side effects that were previously undetected in clinical studies. Next question, does Lexapro damage the brain? Well, actually, when I was researching this question a little bit, I know a lot, but I thought I would look up some more. And I found an article in the Current Biology. It was actually a bit of an older article. They did a study that was a functional MRI and found that people taking Lexapro and other antidepressants, actually there's an alteration in the architecture of the brain within hours. That a single dose of many of these highly prescribed meds used for the treatment of depression cause quantifiable changes in the entire brain in a matter of hours. So I thought that was quite interesting. Next question, what are the bad side effects of Lexapro? There is a very, very long list here. Again, most of these are more attributed to, like if you're having, for lack of any better term, an allergic reaction to them. Serotonin syndrome, that's something that usually takes a little while to build up. It's not usually something that happens within the first few weeks of taking the medication. Coma, definitely a bad, serious side effect. And these other things are more associated with a allergic reaction. That would be rapid heartbeat, a sudden change in blood pressure, feeling dizzy, excessive sweating, flushing, hyperthermia, meaning that your body's very hot, tremors, muscle rigidity, muscle spasms or twitching, lack of coordination, seizure, nausea, vomiting, and diarrhea. Doesn't sound fun. How long can I stay on Lexapro? In my personal opinion, these medications are meant for crisis situations when, due to availability of a person's ability to change lifestyle or urgent crises, the short-term induction should almost immediately be tailored in tandem along with looking for holistic alternatives, getting counseling, and other things that do not involve drug care so that you can get back off of these medications without having any long-term effects. There is a lot of medical consensus around that a first-time major depressive event, 6 to 9 months, is a period of time for using the medication, and if there are multiple relapses during that time, maybe up to 2 years. But after 2 years, the drug really doesn't show much clinical effectiveness, especially when contrasted with the potential long-term side effects. Next question, how can I get off Lexapro naturally? Well, this is different for every person. However, since Lexapro is basically spending serotonin, on a neurochemical level, the thing that you would want to do to try to get off of Lexapro is to try to build that serotonin up naturally through precursors such as, we like tryptophan the most, but also 5-HTP, other amino acid precursors, and looking to eliminate any toxic impairments, with mercury being the most prevalent. Mercury is a very potent poison to serotonin synthesis and manifests as someone who that has a mercury burden. They have a constant, unrelenting anxiety, fight or flight ruminations, and challenges with sleep or insomnia that don't really come and go. They're pretty much a background roar of the nervous system. So getting that mercury out of there is kind of paramount for that. If that's what's going on, there's really nothing else that can penetrate that besides unburdening that toxic burden. Next question, can Lexapro cause permanent damage? Well, a lot of this isn't all that well understood. However, if you look at anywhere about the stories of people coming off these meds and having long-term challenges that last many months or years, that include brain zaps and anxiety and sleepless nights, these are strong indicators that there is adaptations happening in the brain that don't correct themselves, nearly as quickly as the 2 weeks that a person is told that they'll adapt to the drug. A lot of people are suffering with these changes for a lot longer. So I would say not completely permanent, but at least semi-permanent, I would say. Can Lexapro cause brain fog? Again, it's a bit like a teeter-totter. So dopamine, norepinephrine, acetylcholine, these are all things that reinforce your learning, that keep you attentive, that keep your spine erect, that keep you engaged. Anytime you're counterbalancing that with adding more of an inhibitory neurochemical, you're going to feel more lethargic, more just fuzzy, more, not as awake. And so, yes, and there is evidence to show that, especially in people who are over 65 years old, that it's associated with memory problems and confusion. This may be due to the notion that the levels of sodium in the blood of people who are taking that are reduced, but there may also be other mechanisms for it as well that we're unaware of. Is Lexapro hard on the liver? I mean, it's not the hardest drug on the liver, but your liver, the job of your liver is to take a poison like these medications and biotransform it using enzymes into something that your body can actually eliminate. If that wasn't happening, these things would build up to toxic levels and eventually poison you. So that process is going to cause destruction of liver cells to a certain degree and increase your liver enzymes, which are demonstrable on a drug like Lexapro. So monitoring your liver enzymes to seeing how much of an effect this drug is having on your liver is at least one way to screen for that. Next question, can Lexapro change your personality? I mean, yes, like any other drug, like any other kind of substance, like if you drink alcohol, is that going to change your personality? Well, yes, because it has had a certain physiological effect. These drugs are going to have a physiological effect that is going to be noticed as changes in your personality. I mean, are suddenly you're going to go from a God-fearing good person to being like demonstrably evil? Very unlikely. It's not going to change like the core essence of who you are necessarily. Just like alcohol may or may not. I mean, in some people, yeah, alcohol is going to turn them into a completely different Jekyll and Hyde sort of person. Not quite as likely here on Lexapro. If you're raising your availability of serotonin, albeit maybe temporarily, but you're raising your inhibitory neurochemical, you may find yourself less anxious. You may find yourself more anxious in some scenarios. By getting more sleep, maybe you feel less angry at people. If you were having anger and impulse control problems before, one of the effects of the drug might be to soften that. So to that degree, yes, you can expect changes in your personality, and some of those may be changes that you welcome, and some of those may be changes that you don't. Next question, and it looks like the last question, is Lexapro linked to dementia? Especially in the older population, yes it is. And, there's some theories because it's anticholinergic, choline, acetylcholine being a neurochemical that helps reinforce learning process, that these antidepressants that are opposing that will result in memory deficit and sluggish learning. Lexapro is not that strong of an anticholinergic, so that probably is not the mechanism, but they are associated with increasing dementia. And I just would imagine if you're more sluggish and more like, you're not as interested in learning and staying focused and staying attentive in the first place. And, to a certain degree, depression itself can be associated with dementia because we're just not as interested in being alive, and, that makes you crazy. So anyway, that is the end of our video. Thank you so much for watching and sticking with us, and I hope you have a good evening or night. And do remember that if you are planning on changing your medications, don't do so based upon what you've seen on this video. Please consult your doctor or your prescriber and let them guide the process, or call us and check out what type of services that we have that can help you in those ways. Thank you.
Thank you for watching. Don't forget to subscribe to our channel. For information about Alternative to Med Center, give us a call at 888-984-9667.